Hello and welcome. This is Intimacy After, a podcast for mature women facing intimacy issues from various causes. Please know you are not alone. It is time to stop suffering in silence. On this podcast, we give hope that through practice of simple steps and proven tips, you can improve intimacy and resurrect your love life. Break free, learn to laugh again, to play again, to be happy, to love, and know that you are loved. I am your host, Queen. Come on inside. A warm welcome inside to yet another episode of Intimacy After. I'm so glad you've joined me today. I had the absolute pleasure of speaking at a ladies' conference hosted by Pastor Renee Dotson, the final chapter of I Love Me Better Than That retreat. It was absolutely phenomenal. Pastor Renee is a one-of-a-kind, warm-hearted gem, and all the speakers were simply awesome and blessed us all. To all the attendees, thank you for making this event spectacular. Thanks again, Pastor Renee and Angie M. for the invite. Coming down from the high of that ladies' retreat, I had to make sure to get this information out in a timely manner. Twice per month? Yep, I could do that. I want to start by acknowledging each of you, my breast cancer survivors, thrivers, and overcomers who were celebrated extensively during this month of October. But it doesn't stop there. It doesn't stop there, does it? And the unique journeys you're on or have been on continues. Facing breast cancer can have a profound impact on your lives and relationship. As a radiation oncologist, I've seen firsthand how cancer can alter every facet of life, including intimacy, which is often overlooked, though deeply significant. I'm committed to addressing these concerns because I believe that healing is about more than just treating the disease. It's about embracing life fully after all the active treatment is completed. In today's episode, we're going to dive into the emotional, physical, and relationship aspect of intimacy, specifically after breast cancer. Breast cancer diagnosis is overwhelmingly common, and many of you have reached out with specific questions. I'll try to answer as many within the context of this podcast without making it too lengthy. So I ask in advance for your grace if I don't get to answer your specific questions. Keep an eye and an ear out for upcoming monthly Q&A about health starting in 2025. But I just want you to know, I hear you. Let's explore how important it is to approach this healing process holistically, ensuring that every part of your journey receives the attention that it deserves. Let's start by addressing what you can see. Let's address the physical aspect, the physical changes you might be experiencing. First thing to know is that it is normal to be apprehensive about the changes you see when you look in the mirror or the feel of your breast. Some of you have larger breasts, so the changes may or may not be as noticeable versus someone who has a size AB cup. Wait, let me not get ahead of myself though. Let's talk about the changes based on the type of surgery that you've had. Stepping back a bit, if you go to my website, there are links that are for self-education, both free videos and affordable course. But have no fear. I'll cover some basics here for my listeners who are not breast cancer survivors, thrivers, or overcomers. If you have not been directly affected by breast cancer, welcome. This will provide some insight into what your family or friend may be experiencing. Let's start with the type of surgeries. I will do some basics for those who have not gone through breast cancer diagnosis and for those who never truly understood the differences, right? Now, you know me by now. I like to keep things simple. Therefore, if you are in the medical field, this simplistic approach may be a little bit too simple for you, but I have to address the majority of my listeners. So hang in there with me. I'll get to that. So the surgeries are lumpectomy, mastectomy, and after mastectomy, some folks may opt for reconstruction. There are different types of reconstructive surgeries, which are beyond the scope of this podcast, but will provide some guidance on questions that you may consider asking. Let's first look at lumpectomy. Simply speaking, imagine you baked a small lemon pound cake and there is a raisin in it. A raisin does not belong in a lemon pound cake. If the pound cake is your breast and the raisin is the cancer, a lumpectomy is like removing that raisin only from the pound cake, your breast. The doctor takes out just the lump, or the tumor/raisin in this case, and a little bit of the surrounding tissue, leaving most of the breast as it is, otherwise intact. It's done to remove the cancer while keeping as much of the breast as possible. Essentially, you'll have a lemon pound cake with an area of defect where the raisin was removed. Now, that area of defect, like scooping out a scoop of ice cream, that will be filled in with fluid, but the body will eventually resolve that. You may feel a knot after the surgery for a while, but eventually that will go away, or in some cases, it will just stay there and it'll just be a little firmer than usual. If you have opted to have a mastectomy, now the mastectomy is when the doctor removes the whole breast. That is, the whole lemon pound cake is removed because the raisin is too large or too many raisins got into the lemon pound cake. Does that make sense? So multiple lumpectomies to remove all the little raisins will leave a lot of cavity and change that the shape of the breast may not be cosmetically pleasing. So a mastectomy is sometimes done if the cancer is large or if there are multiple spots with cancer in the breast. It's a bigger surgery than a lumpectomy, but it helps make sure all the cancer cells are taken out. Conversely, if it is a large raisin and you have a small breast, attempting to do a lumpectomy will essentially take away all the breast tissue. So it's like a small lemon cake that has a big date or prune. So trying to preserve the breast would not be recommended in those cases. Talk to your doctor and make sure you understand which procedure is better for you if you have not started on this journey. Reconstructive surgery after mastectomy, though, is a whole nother conversation. After a mastectomy, some people choose to have reconstructive surgery, which is when the doctor rebuilds the shape of the breast, create a whole new pound cake, if you will. This can be done with tissue from other parts of the body or with implants. It helps make the chest look more like it did before in clothing. Some may opt for larger breasts, smaller breasts during reconstruction, and some of you may opt to not do any reconstruction at all, instead preferring to use prosthesis. False material in the bra or just nothing at all, choosing to remain flat-chested. Look, all of that are decisions that you make after informed conversation with your physician. And that is why I always recommend having conversations with your doctors. Don't be intimidated. Write down the stuff that you need to ask and make sure you know what to expect. And that's what the journal and guide is for, specifically the breast cancer journal and guide, which is also on my website. It kind of holds your hands and walk you through the questions to ask. And then there's also space to write down the answer. And don't be afraid to ask your doctor to simplify it so you can understand, right? Look, I cannot begin to tell you how many patients have asked what they should do as it pertains to surgeries. But disclaimer here, I'm famous for my disclaimers, right? I am not on your medical team, and the decision to have lumpectomy versus mastectomy and or reconstructive surgery should not be taken lightly. Of course, sometimes the decision is made for you, tumors too large or too many small ones. But if just embarking on this journey, always ask, how will I know if I need radiation therapy after surgery? Hint, hint, you should speak to a radiation oncologist, right? If I opt for lumpectomy, what will my breast look like? What about the nipples? Will I lose that? Hint, hint, I've had folks who were surprised that, hey, I didn't know I was going to lose my nipples. Worth a conversation if the tumor is close to the nipple. Next question. If I have mastectomy, how long after surgery do I have to decide whether or not I want to have reconstruction? Just in case you want to change your mind one way or the other. There are a lot more questions in the journal and guide on my website that will help you walk through the process of questions to ask before, during, and after treatment. And you can pick that book up on Amazon at any time. Remember, these surgical options depends on how much cancer there is and your personal choice. This will help each person get the care that's best suited for them, the best decision for you. Let's address the physical impact of these surgeries. So currently, when you look in the mirror, what do you see? Wait, do you ever look at yourself in the mirror naked? Some of you may initially disregard the area where you had surgery and try to make it as though it's not a part of you anymore. Treat it like a separate thing. It's difficult, yes, but you should look. Go and look now as you listen, if able to do so. Take a look at your body. What do you think about what you see? How does your breast feel? Is there feeling in the breast area from the surgery? Is it firm? Hard? If you have not touched your breast since lumpectomy, it's okay to do so. Are you comfortable with the outcome and what you see? This is the first hurdle, right? In the back of most folks' mind is that men are visual creatures, and you are looking at yourself and thinking, this does not look visually appealing. I cannot let him see me like this. But, sister friend, yes, you can. Despite that whole thing about being visually appealing, what's even deeper than that is the love that your mate has for you. But we'll get through how to walk through this. First, though, you have to get over the hurdle yourself. Become comfortable with the new you. If you had a mastectomy and opted for no reconstruction, the chest scar can be challenging to accept initially. My patient in the past who had sizable breast considered this a very high hurdle. For those who were cup A or B, flat chest or no breast, is not a far cry from what they had, but it is still very different. My patient typically appreciated the acknowledgement that yes, the area is firm. Yes, the area is different. Yes, this is normal for patients who had this type of surgery, or no, this is not the normal. your surgery was a little bit more extensive, or whatever the case may be. As a physician, I had to remember that ladies post any surgeries do not go around showing themselves and their scars to other ladies. Even with increased social media posting, some report feeling offended. Others wish they could see more variety, or a mixture of both are reported. Most physicians fail to realize that they are the eyes of normalcy for most patients. Yet, everyone remains unique in their outcome, right? Some surgical outcomes are quite artistic and scars are minimal, while others, well, not done with such finesse. Some surgeons will tell you the extra tissue was left for possibilities of reconstruction, or the patient was more heavy set and too much tissue, or something in between. Most of you were more concerned about getting rid of the cancer, and nothing cosmetic crossed your mind at that time. However, if you're at the beginning of your process, the surgery, it is worthwhile asking about expected cosmetic outcome. You should not be surprised to find that the nipple was taken if that was not discussed. And if the tumor is close to the nipple and the nipple is taken, ask about tattooing the nipple back on later. I have seen quite a few awesome tattooed on nipples. Also remember, whatever scar that is there, if you have radiation, that will make the scar more pronounced. And if you're post-lumpectomy, it can cause the breast to shrink after radiation. Yes, these are the questions are in the book and the conversation that you should have with your doctors. There are specific questions for the surgeons, specific questions for the medical oncologist, that's the doctor who gives chemotherapy, and specific questions for radiation oncologist. One step at a time, but you need to ask these questions and write them down so you can look at them later. If you had reconstruction, while there is a breast structure there, you may find that physically the function is quite different, such as you cannot feel anything. It may not look balanced in the mirror, and sometimes you may even forget that it is there. What you see and feel after breast cancer treatment can affect desire and even your physical comfort. It's a journey. So thinking of your mate in the mix can bring on quite a bit of apprehension. So you have to start with you first. It is not selfish. Processing your journey and the physical changes will take time. You must find a way to express that without totally alienating or shutting out your hubby. Your concerns about scars, body changes, radiation treatment effect, chemotherapy treatment effect, and adjustments that are necessary, they are perfectly okay. One helpful approach is to focus on gentle exercises or physical therapies that can help rebuild strength and boost confidence. Above all, it is crucial to discover what feels pleasurable and comforting to you, sister friend. You must acknowledge your physical changes in order to reclaim intimacy. Start with navigating physical sensitivities, right? Like altered sensations, scars, or pain, which can influence how you may feel about physical intimacy. Discuss strategies to approach physical touch. Gradually, starting with gentle, nonsexual touch to reestablish comfort and confidence. Then try creating new definition of intimacy for yourself and your hubby. Explore the idea that intimacy doesn't have to be limited to traditional sexual expressions. talk about sensory intimacy, working around any current limitations. Example, you may consider massages, baths together, gentle touch. These are very powerful ways to feel connected and reawaken physical closeness without pressure or expectation. When there's no expectation, then self-discovery and open communication are at its best. It's important to discover your own comfort zone, right? Which may have shifted after breast cancer treatment. It is important to explore and communicate these boundaries with your partner, despite the challenges. Honest discussion about likes, dislikes, and current needs can be empowering. This will segue into the emotional journey to embracing intimacy after breast cancer. We have discussed a lot already, and the emotional is intertwined with the physical. It's normal to experience changes in body image and self-esteem. You may feel vulnerable or even fearful of rejection. It's important to give yourself grace and patience as you navigate these emotions. Self-compassion can be a powerful ally, as can joining support groups or seeking guidance from counselors who understand your journey. It's important to find counselors who can understand what your journey looked like as a cancer survivor, thriver, or overcomer. The issues you're facing having completed cancer treatment would be different from others, and that need to be acknowledged during your counseling session. But it is important to acknowledge your loss and the many changes. Breast cancer can definitely alter your self-image and relationship with your body. Many of you survivors, thrivers, and overcomers feel a sense of loss or struggle with confidence, especially for those of you who had the breast cancer journey twice, or you're currently dealing with metastatic breast cancer. I hear you. The emotional roller coaster of being tearful, angry, being okay with it, back to being scared, and a range of emotions can be weary. It is important to recognize these feelings and write about it to yourself to encourage the healing process. Pre-COVID, I had conversations with survivors, thrivers, and overcomers who were in the public eye for one reason or another, career-related. The treatment changed their appearance in clothing, or certain scars from radiation could be seen, or the wigs were not as complimentary. That is when reframing and transparency are your best weapon. Not to encourage pity, but to make others aware that they were warriors, and what they are seeing is a fighting spirit holding on. Working from home post-COVID is not as bad anymore, and with the internet, awareness has made a big change for many. However, accepting one's body post-treatment remains a personal journey. It is crucial to embrace self-compassion on the path to self-acceptance and emotional healing. I've mentioned journaling before. That's because it's a way to be a true and great friend to yourself. You are able to revisit and see your thoughts and how you had different situations at different times and how you handled stuff. It's never too late to start journaling. Also, practicing mindfulness and consider exploring therapy for assistance in areas where you struggle is highly recommended. You are not alone. It is never too late or a bad idea to seek therapy. Try a couple sessions at least before you say no to therapy or speaking to others. Once you have addressed self and at a good place, then work on reestablishing emotional connection with your partner, right? It's a stepwise process. You cannot just jump to the end and expect acceptance and reciprocity and everything being okay when you haven't dealt with yourself first. So it takes understanding and it does take time. Again, talk about how to rekindle that emotional intimacy by openly discussing fears and desires, allowing vulnerability to rebuild trust and your closeness. Openness can be a healing process for both you and your partner. It might feel daunting to discuss needs and boundaries, but it's important for building understanding and support. Share your feelings. Listen to each other. This can foster empathy and can deepen your connection. It's also an opportunity to be creative and discover new forms of closeness beyond the physical. Emotional intimacy can be immensely fulfilling and can bring you closer to your partner in meaningful ways. In my previous podcast, we discussed other ways that you can be intimate without physical intercourse. I think that can apply here as well. It's just a big, broad scope umbrella of all the different things that you can explore. Don't give up. Know that you are not alone, right? And if you are with someone, you have to encourage them to be with you on the journey once you have attended to yourself. If you are single, ladies, the approach is relatively the same. You have to be comfortable with yourself first before you can go seeking a mate, because then you'd have to have steps in how to incorporate conversations with your mate about the process you have been through in order to lead to intimacy together. So whether you have a mate now or you do not, the process starts with you. Embracing intimacy after breast cancer is a gradual personal journey, and there is no single right way to go about it. Be encouraged, and please be patient and kind to yourself. Prioritize your well-being and reach out for help if needed. And always remember, celebrate every small step towards reconnecting with yourself and your loved ones. I hope this episode has been helpful and reassuring as you continue your journey. Well, sister friend, I know you have choices, so I thank you for tuning into Intimacy After podcast. You may subscribe for bi-monthly alerts or stay in the know by visiting my website at queenquanta.com. That's Queen, QUANTA.com. Until next time, remember, a life without intimacy is like your favorite meal without salt. Ladies, let's spice it up. Life is beautiful and God is awesome. This is Queen, signing out.